Hello, everybody. Welcome to this month's Patient Education Facebook Live. My name is Danielle, and today I'm here with two of our providers and one of our nurses to talk about a really important health topic. For those that don't know us, we're Cahaba Medical Care, the home for all your healthcare needs. We're a community health center with 22 locations across Central Alabama, and we provide primary, prenatal, and mental health care to you and your family. Today I'm here with Dr. John Waits. He's a family physician that's been serving communities in Central Alabama for 2 decades now. He's also the CEO of Cahaba Medical Care, so we're glad that he's taken the time to be with us here today. Joining us is also Dr. Dakota Price. He's been with Cahaba for 4 years, and he serves primarily at our West End location. Ashley Middlebrooks is a nurse that's been with Cahaba for 11 years now. So this Monday, June 27th, was National HIV Testing Day, if you caught that Facebook post. So today we're discussing a very important health topic, HIV. What is it? Is it dangerous? Can it be treated or prevented? Who should get tested? I'll give you a hint. If you're a human above the age of 15, you're going to want to keep watching. So stay tuned to learn more and make sure to comment your questions below, and we'll be monitoring the questions so we can get them answered during our live stream. We're going to start it off with Dr. Waits. Dr. Waits, tell us, what is HIV?
Thanks, Danielle, and thanks for being here, everybody. HIV stands for Human Immunodeficiency Virus, and it's just that, a virus that infects humans. But instead of infecting something like your nose or your gut, something like COVID infected, the lining of the respiratory tract. This treacherous virus, HIV, it attacks a particular white blood cell called a CD4 cell. White blood cells are a critical part of your immune system. So when you first get infected with HIV, some people have a flu-like illness, but for the most part, this is a hidden infection. It hides in your immune system and really only shows up later in life, years down the road, when you get a disease that would be very unusual in someone whose white blood cells are working properly. So this disease state where you're getting infections from a weakened immune system, you might have heard of it. It's called AIDS, or acquired immune deficiency syndrome. So AIDS was discovered in the 1980s. At that time, in almost every case, it was fatal and just a miserable death sentence from these very strange infections. Most prominently, people that remember the 1980s will remember that most prominently men who had sex with men would get this disease. But statistically, there were many other people who contracted this disease. Back then, it often came from blood transfusions. We test for this now, so that's less common. And it also has affected many heterosexual women who were mothers and tragically, in many cases, passed on HIV to their children. It really was a slow burning crisis, as many of us remember from the 80s and 90s. I remember being in medical school where every treatment we developed, the virus would develop a resistance to it. And very relevant to the last 2 years of COVID, where we had a miraculous appearance of several successful vaccines. Every attempt to develop a successful vaccine to HIV was unsuccessful. Over and over. It was just really discouraging. So the despair of the 20th century has kind of really turned the corner with respect to HIV. So I want to pay it forward to Dr. Dakota Price, family doc and HIV medicine expert at Cahaba Medical Care, and talk to us about this renaissance in treatment for HIV and kind of, Dakota, where are we in the 2020s related to HIV treatment?
Yeah, thanks for the introduction, Dr. Waits, and thanks for asking. I consider it one of the greatest successes in the last decades in medicine development with HIV treatment. It's really been amazing to watch and to be a part of now, going from a disease that, like you said, was fatal. We didn't have a treatment, and we did start getting treatment, but it was really toxic in the beginning. To now, today, we have a plethora of options before us that are safe and effective, and most of the time come in just one pill a day. We've even moved now to starting to develop treatments such as injections every couple months, and they are looking to do more things such as implantables that may release medicine, but lots of options out there. I always tell my patients, in the beginning, that this is not a death sentence anymore, that you can live a normal, healthy life. If we pick it up, we diagnose you, if we get you on the medicines and monitor you along the way, you'll be a normal, healthy person. And so it's a very good time to see this treatment come about.
Yeah, that's really so crazy how it went from this mystery illness that nobody really knew what to do with, nobody knew where it was coming from or how to treat it, to now you can be treated and live a normal life with just one pill a day if you seek treatment, right? But I'm also wondering, it's a scary illness, and we have treatment for it, but is there any way to prevent it, Dr. Price?
Absolutely. And HIV is, we call an STD. It's a sexually transmitted disease. And so you can't get it from someone by sneezing on you. All right. You don't have to worry about that. Just to also remove the stigma for people with HIV. That's not from contact with skin or respiratory secretions or anything like that. And actually, it takes a lot of blood to actually transmit HIV. It's more so sexually transmitted. And so that's one thing is if you're not intimate or have chose to be sexually active, you can't get the virus most times. But the other thing for preventing the spread of HIV that we're really pushing is getting people diagnosed early on and getting what we call their viral load undetectable in the body. And that's we're measuring how much of the virus is floating around. And the CDC put out a statement a couple of years ago, which is really freeing to people with HIV, is that it's the saying we call U equals U. So if you are undetectable, you are untransmittable, meaning that you cannot give HIV if you are undetectable. So that is really good news, but we got to identify you and start treating you. So that's the most important thing I want to push home for people. Condoms are effective in preventing lots of different STDs, including HIV, about the 80%, if used every time and with perfect usage. And then we have something that we've been talking about lately called PrEP. And PrEP stands for pre-exposure prophylaxis. And so, and really, if you are sexually active, you can be on PrEP. But we really encourage it for people who has multiple sexual partners, men that have sex with men. And if you have a partner who has HIV, what we call a discordant couple, meaning you don't have HIV, but your partner does have it, then you may be a candidate for PrEP treatment.
Good to know. So yeah, it sounds like really all of us should be thinking about HIV and finding ways, we can prevent it, protect ourselves from it, talking to our doctor about PrEP, if that's something that we think we should go on. I know one of the questions that people have about PrEP is, are there any side effects?
So PrEP is a daily medication as well. It's actually some of the medicines we use to treat people with HIV. It targets the virus in the early stages of its replication to prevent it from entering into those white blood cells that Dr. Waits talked about. And it's very effective. It's up to 90% effective in preventing acute HIV infection. And so like any medicine, it comes with, it has to be monitored very closely. These medicines are very safe, very effective. And we need to, we want to make sure you don't get acute HIV while you're on the medicine, because it's not the appropriate treatment. And so that is one thing, is that if you do get HIV, that we need to know if you have it or not. So we want to monitor that along the way. We also want to make sure you don't have other infections like hepatitis, like Hep B is one that we look for. And then the medicine needs to be adjusted or discontinued if your kidneys aren't working correctly. And so we do monitor that along the way. And so very safe, effective medicine, but there are some things that we need to monitor and that you continue to see us at the doctor for, usually on a 3-month basis.
Gotcha. So from what I'm hearing is if you have HIV, come to Cahaba, we can help you get treatment. If you don't have HIV, let's prevent it. Let's get you on PrEP. And really, it's just taking one pill a day. I think a lot of people are already taking, migraine preventive medicine for birth control. So yeah, PrEP from our end is just one pill a day, and we can, depend on Cahaba to make sure we're getting tested regularly and, don't have those kidney problems you were talking about. Ashley, I've got a question for you. Will insurance cover PrEP, or what if I don't have insurance? Can I still get it?
Yes, absolutely. So most major insurances do cover PrEP. And if you are uninsured or if your insurance does not cover PrEP, our team at Cahaba can help. There's programs that cover the cost, so we can help get you enrolled in those programs at no cost to you.
Good to know. And how can I get PrEP at Cahaba? Do I need to call someone, fill out an online form? What do I do?
Yes, so you can go to our website at cahabamedicalcare.com/prep, or you can call 205-277-2542, and we can get you more information and get you scheduled with one of our counselors or one of our physicians.
That is good to know. So I just want everyone that's watching to know it is so easy to get connected to Cahaba to talk about PrEP with a provider. We've got this direct line, 205-277-2542. I'll put that in the comments so you can have it later on. You can call that and you can talk to somebody immediately about getting you in to talk about PrEP with your provider, or you can fill out an online form. Again, that's cahabamedicalcare.com/prep. Ashley, there's one other thing that we haven't talked about yet. So Monday was National HIV Testing Day. So tell us a little bit about testing. Who should get tested, how often, and why should we get tested?
Absolutely. So everyone starting at age 15 should get tested. Sooner if you become sexually active. You should get tested at least once in your lifetime, but anytime that you have a change in sexual partners, or anytime that you are concerned that you have been exposed, most insurances will pay for testing every single year. Everyone should get tested because, like Dr. Waits mentioned earlier on, the reason is so important to get tested, even if you have no symptoms, and even if it seems like you might be unlikely to have the HIV virus. And in this amazing 2022, unlike the 1980s, we can treat it and possibly even cure HIV before it ever has an effect on your immune system. So this is why there's a big push for universal testing, which means that we want to test everyone.
Yeah, so if you're above the age of 15 and you've never been HIV tested, give us a call. It's not a scary test of any sort. It's just blood work, and you'll talk to your doctor afterwards. Yeah, thank you for telling us more about that, Ashley. Well, Dr. Price, Dr. Waits, I know that this is a topic that is near and dear to your hearts. Dr. Waits, do you have anything else you'd just like to say about the topic of HIV testing and PrEP and the HIV epidemic?
I'll just kind of hammer home what Ashley just said. A decade ago, a generation ago, it was, why should I get tested? I don't have risk factors and the medicine isn't that good. We are in the era, as Dr. Price said, where, you can really make this undetectable, untransmittable. So many more people should get tested just on the off chance that they've contracted it from some sort of blood exchange or sexual contact, because the consequences of having it undetected are huge, and the ease at which we can treat it completely is now available to us. So take advantage of that.
Yeah, thanks for that, Dr. Waits. And thank you everybody for watching. Thank you for Dr. Waits, Dr. Price, Ashley for joining us today to talk about this topic. If you're watching later on today, go ahead and comment your questions below and we will get back to you. Remember to visit cahabamedicalcare.com/prep to learn more. You can fill out an online form and just ask questions that you have. You can also give us a call at 205-277-2542 or visit your local health center, your local Cahaba Medical Care location to talk to your provider about PrEP, testing, treatment, whatever it is that you need to talk to your provider about. We're here to take care of you. So thank you guys again for watching. Thank you to everybody for joining our panel today, and have a great day.
Thanks, Danielle.